Dr. Jaspreet Singh, Newburgh, New York, talking about benign prostate hyperplasia, a condition that affects nearly 70% of men by the age of 70. This particular patient is a 74-year-old male, long time history of poor urinary stream. Here we're taking a look at the channel as it runs through the prostate. As you can see, the lobes of the prostate have compressed and squeezed against this urethra. We're using a Urolift device. This procedure is safely done in the office or an ambulatory setting. Here we're using the device to compress the prostate tissue, moving it out of the way. It's like opening curtains on a Broadway play. Placing the stitch allows that prostate to remain compressed and sweep it away from the urethra. Here again, we're pushing the other side of the prostate, assessing the appropriate positioning and cutting the excess suture. This allows the prostate at the bladder neck to have been swept away in a nice fashion. Here I'm coming back towards the apex of the prostate. We're pressing against the prostate lobe, pushing it out of the way and placing our third stitch. This is truly a real-time video. The whole procedure takes roughly 8 to 10 minutes. The patient has mild sedation. No need for general anesthesia, no need for a Foley catheter after the procedure. In addition, what allows such great results is the minimal bleeding that's noted throughout the procedure. Here we've placed 4 stitches. I'm taking a final look. I feel as though I can get better results by placing another stitch at the apex of the prostate. This particular technique is called a stacking technique. Inspection reveals the bladder opening to be open. I have swept the prostate out of the way. Total of 5 stitches needed for this patient. Of note, his total prostate size was roughly 50 grams, of which a normal prostate size is about 20 grams. You can see the before and after pictures. The channel is now unobstructed, allowing this patient to urinate with a strong stream. He is also allowed to stop his medications after a week of the procedure. One of the main concerns the patient had was to minimize his medications. As a 74-year-old male, he's taking several other medicines for his other medical conditions such as high blood pressure. Having this procedure has allowed him safely to stop medicines for his prostate. This is Dr. Jaspreet Singh, Newburgh, New York, talking about the Urolift procedure.